As a medical coder, everyone needs to know the updates related to acidity in CM, and also last year October we have started new updates, and again in April 2026 also we need to follow few acidity in CM updates. So in this session we will learn all the updates which we need to use from April 1st 2026. If you like this session after watching, please click on like button and hype the video. Basically from April 1st 2026 we don't have much updates. Basically here they have changed excludes 1 to excludes 2 as well as excludes 2 to excludes 1. So first we will learn about what is exclude 1 and what is excludes 2. So exclude 1 means not coded here. So basically the note or code under notes is not coded with the primary code. What is excludes 2? So excludes 2 is not included here. So here we will code the code which is under the notes along with the primary code. No need to worry, we will see few example scenarios going further. First we will see updates related to neoplasms, and we will learn this neoplasm update practically. So basically if you observe here, so we have code D18. So hemangioma and lymphangioma any site. So here previously, like before April 1st 2026, it is type 1 excludes, means we can't code D356, D22, D22, Q82.5 along with D18. Okay, as here we have excludes 1 node. Now from April 1st 2026 they have changed it to type 2 excludes, means if the patient is having hemangioma and lymphangioma any site along with benign neoplasm of glomus jugulare, we need to code both codes. So you will not get any edit. So here it is simple. So previously it is type 1 excludes. So we can't code hemangioma as well as benign neoplasm of glomus jugulare. But April 1st onwards we can code both hemangioma and lymphangioma any site as well as benign neoplasm of glomus jugulare. So this is very simple update. Next we will see updates from these are the blood and blood forming organs and certain disorders involving the immune mechanism. So here we have one more update. So an exclude one node for D79. So this is D72.819. Here we have one exclude one node for malignant leukopenia D70.9. So for example, if the patient is having both decreased white blood cell count as well as malignant leukopenia, we need to use any one code, not both. This is the new update. We will see practically. So previously, like before April 1st 2026, we can't code other hyperparathyroidism along with familial hypocalciuric hypercalcemia. But April 1st 2026, we can code both other hyperparathyroidism as well as familial hypocalciuric hypercalcemia. So basically here also they have changed type 1 excludes to type 2 excludes, means we can code both condition if the patient is having, like we can code E21.2 as well as E83.52 based on documentation. So here there is no much change in post-concussional syndrome. So just they have added one more code along with type 1 excludes. So previously we have concurrent like current concussion as well as post-encephalitic syndrome. Now they have added one more code related to S06.0X. So again in reserved nervous system also they have changed exclude 1 to exclude 2. Next we have reserved the I and adnexa. So here they have changed only code first instructional note. So basically code first to code also. So code first means mandatorily we need to use the code first. But here from April 1st 2026, you don't need to code it as first. You can code additionally if the documentation supports. So next, these are the circulatory system. So here also same, excludes 1. So change to excludes 2. Okay. And also they have changed like use additional code instruction notes to code also instructional note. So in respiratory system also same. So previously we have excludes 1 note under J96 along with J95.82. So now we can code if the patient is having both respiratory failure as well as post-procedural respiratory failure. Next we have TC of the digestive system. So here there is no change. Basically they have deleted excludes 1 under K61. So in disease of the genitourinary system, a use additional code to identify associated cachexia instructional note was added under category N18. So just along with the N18 or chronic kidney disease, now onwards we need to use cachexia. So E88.A if the documentation supports. So use additional code means if the documentation supports basically. Next we have guidelines related to congenital malformation, deformation and chromosomal abnormalities. So basically here they have changed the title of congenital malformation. So if anyone looking for medical coding jobs in UAE, USA and India, please join in our WhatsApp group. Group link is in the description of this video. And if anyone looking for same day surgery training, IPDRG training, SEC training, CCA certification training, please send WhatsApp message to 707-526-3939. So in symptoms or R series also they have changed exclude 1 to excludes 2. Okay. So now we can code dyspepsia along with heartburn. Next we have codes related to injury poisoning. Okay. So here also basically they have changed exclude 1 to excludes 2. Next we have codes or updates related to factors influencing health status. So here also they have changed excludes 1 to excludes 2. So basically here now we can use F11.9 along with F11.2 if the documentation supports. I hope this session will be very useful for you. So basically all these are self-explanatory. If you are unable to understand, please mention in the comment section of this video so that I can create one more video related to your complications or your doubts. One more time, thanks for visiting Passcode of 21. So if anyone looking for trainings like surgery, inpatient, SEC, CCS, please send WhatsApp message to 707-526-3939.